Hi, I'm Dr. Patricio Millar. I'm a neurologist at the Dysautonomia Center, and I'm glad to take part of FD Day in its second virtual version. Today, I'm going to talk about something that we've all been living with and experiencing for the past year: COVID-19 and vaccines. So, since the pandemic started, millions of people around the world have been affected by COVID-19, including many of us. And by now, it's very likely that we've all been either been affected directly by it or have had a family member or a friend that has been affected by COVID too. During the early days of the pandemic, something that we were concerned or worried about was how would people with FD do if they were to have COVID-19. We know that pulmonary and respiratory problems are a common concern in FD, and knowing that COVID is a disease that primarily affects the lungs and the respiratory system, this was a big concern for us too, as well as if this would trigger severe or unrelated crises too. Fortunately, so far we only have a record of 14 cases of COVID-19 among FD patients, including a patient that even had COVID twice. We've heard about cases across 4 different countries in patients with ages ranging as young as 13 years of age all the way to 50 years of age. And to put this into perspective, this is about 5% of the FD community, which when compared to the whole population is about as half as the proportion of people who has had COVID in the US. And this is a relatively low number, which is a reflection of the great job our community has been doing in keeping safe with recommended measures to prevent infection, such as wearing face masks, keeping social distancing, and hand washing. And we want to congratulate you for that, because that's an accomplishment that you've achieved by yourselves. Only 3 patients needed to be hospitalized for COVID-related complications, one of which had serious pulmonary problems to begin with. Another one had pneumonia and metabolic problems that required IV fluids and antibiotics. And there was sadly one patient in Israel who passed away due to direct viral heart complications. But for the most cases, symptoms were mild and could be managed either at home or as outpatients. Many of these people were diagnosed due to a high suspicion for COVID or just as a precaution in the context of having close contacts who had also tested positive. These symptoms ranged from mild fever, cough, feeling tired and lethargic, and some patients had autonomic crises that again could be managed with their usual treatment and medications. Most importantly, we haven't had any reports of people with FD having long hauler syndromes or long-term post-COVID complications. Moving on to vaccines, we know that COVID vaccines are effective. They help reduce the severity of the symptoms, they help avoid hospitalizations, and they help reduce mortality from COVID. Furthermore, it has been more recently shown that they help reduce the transmission of the virus itself as well. So far, we've had over 40 patients with FD receiving different vaccines, including the vaccines from Pfizer, Moderna, AstraZeneca, and Johnson & Johnson, and even some couple of patients younger than 18 years of age. Anticipating flu-like symptoms from the vaccine is a very normal and commonly occurs from any vaccine. These symptoms, which sometimes include fever, malaise, chills, body aches, or local site pain at the injection sites, are all signs that our own body is mounting a good immune response and responding to the vaccine and the antibodies it's creating, which is why it may be more common to have these symptoms for people who have already had COVID or who are getting your second dose. We know that this can create some anxiety around getting the vaccine, but that doesn't mean that everybody will get these symptoms. We've even heard about patients who have had COVID and didn't have any side effects from the vaccine. Nevertheless, we understand that this can be very uncomfortable too, and that in patients with FD, this may even lead to an autonomic crisis. For everyone who has had the vaccine, most people with FD tolerate it very well without any symptoms at all, which is also true in the average population. Sometimes when having the second vaccine, as mentioned before, can elicit more of these symptoms because the immune system is already primed to take action from the first dose. For this reason, and to avoid these symptoms that again could terminate or ultimately lead to an autonomic crisis, we're currently recommending to, in the evening after the second dose, start taking ibuprofen or acetaminophen, also known as paracetamol, and to keep taking it around the clock for the following 2 to 3 days. Some people prefer to take the medications only if they start feeling unwell, or if they take their temperature and find out that they have a fever coming on. But if following this scheduled dosing, it's especially important not to skip any doses at nighttime or during sleep, as many people may wake up during the night with fever or other flu-like symptoms like chills that can quickly mount up to trigger an autonomic crisis. Nevertheless, so far, following these recommendations of taking these medications every 6 or 8 hours as indicated has had a good results, resulting in fewer side effects, better tolerability to the vaccine, and no autonomic crisis. So to sum up, we're happy to see that a few patients with FD who have had COVID have had mild symptoms and fewer complications, and we want to keep it that way. We still encourage people to maintain social distance when possible, to wear face masks in public, and most importantly, to get vaccinated, so we can slowly and safely go back to normal.